Well, hello, everyone. Thank you so much for tuning in today. Welcome to It's Time for More Injury Funding, the podcast for all who want to learn about legal funding and its significance in personal injury, workplace injuries, traumatic brain injury, slip and fall liability, and many other types of law practice domains. I'm your host, founder, and CEO of More Injury Funding, the legal funding counselors with passion for law, medicine, legal funding, and heart for all suffering individuals. More Injury Funding is a host of this podcast and a sponsor, member, associate, or business partner of Academy of Truck Accident Attorneys, Sandy Springs Bar Association, Georgia Association of Paralegals, State Bar of Georgia, Atlanta Legal Aid Society, and Georgia Hispanic Chamber of Commerce. In today's episode, we have two very special guests, Doctors of Chiropractic, George Berbessi and Russell Glassman, with Hamilton Mill Complete Family Care located in Dacula, Georgia. We'll delve deep into the role of chiropractic care in treating personal injury and workers' compensation patients. Welcome to the program, dear doctors.
Thank you, Laura.
Absolutely. Dr. Berbessi, tell me a little bit about your practice and the specialty at your office.
So we specialize mostly in wellness care as well as PI injury. So we have a wide variety of patients that come in every single day seeking care, and we're able to kind of quarterback their care and see exactly where they fit into our.
Great. And Dr. Glassman, can you explain the role of chiropractic care in treating personal injury and workers' compensation patients?
So walk in, we see in this practice probably 25,000 cases of slip and fall, whiplash, traumatic brain injuries, truck accidents, motorcycle, all the accidents you could list. The first thing we do is assessment. We have to find out first what's going on and then what to do.
Okay. And what specific injuries or conditions commonly occur in personal injury and workers' compensation cases that can benefit from chiropractic treatment?
So we see cervical, thoracic, sacral, sprain strain injuries. We see a lot of sciatic injuries, disc injuries that happen as a rise of the traumatic accidents. So these are just some, to name a few.
The main thing is the getting through the triage state. They walk in there in pain and assessing the pain. Is it just swelling or is it something deep? Mm-hmm. And when I mean deep, we look for, Dr. Berbessi and I are very good at assessing to see, is it something deeper than just muscle? If it's muscle and joint, it's usually a simple case, but in our cases, we see a lot of referrals that come in with numbness down there. Mm-hmm. We see a bad injury that has signs of disc injury right away. We see people come in that truly can't walk or can't function. And our goal, the first week assessment, is to assess, diagnose correctly, and try to get them out of pain, not really with chiropractic. We are on multiple disciplinary practice. So what that means is, Laura, we use medical doctors. We want an assessment from the medical doctor. Mm-hmm. We want some trigger points. We want some muscle actions. We want some things that's going to give palliative relief to the patient.
That totally makes sense. How do you stay updated with the latest advancements and research in the field of chiropractic care?
So, I know about that. So, to kind of stay up on the research and the data that's been done. And here of late, we've been kind of focusing more on some of the research that's been coming out. There's 9,000 plus studies out there that will show how chiropractic is beneficial to not just these type of injuries, right? Traumatic injuries, but any sort of musculoskeletal injury that the human body can go through. And furthermore, it shows us that there are tons of benefits timeline wise with those accidents like PI accidents and workman's comp, slip and falls type issues.
And how do you normally approach the assessment and treatment planning for these types of injured and suffering patients?
So like Dr. Glassman mentioned earlier, the first thing that we do is we try and quarterback the entire case, right? We get our patients in the door. We know that there has been some sort of injury, finding out exactly how that injury occurred allows us to then further diagnose using x-rays that we have here in office. And then what that will let us know is, how deep that injury is, right? Is it superficial injury? Is it, biomechanical? Or is it now soft tissue disc herniations, things of that nature? So at that point, we're able to, another thing that we like to do is do a lot of cognitive tests, to rule in or out mild traumatic brain injury. We do this cognitive test. If patients come up negative, we continue on, with X-ray and then furthermore into MRI.
Okay. Could you possibly explain the role of chiropractic care in promoting overall wellness and maintaining a healthy lifestyle?
Absolutely, Laura. We are biomechanical specialists. That's truly what we should have under the title of Doctor of Chiropractic, because we truly know how each joint space moves, how each thing should move. We're able to do a comparative test between left and right shoulder, left and right knee, left and right side of the neck, spine, hip, and with a biomechanical challenge, so to speak, where it's different on one side than the other, we're able to assess the good and then the not so good, and take that one step further, going through to an X-ray. When the X-ray shows nothing, like Dr. Berbessi alluded to, we'll MRI and do a CT to see what's truly causing that change in biomechanics.
And do you have any special equipment to do so, or do you normally refer patients out?
We do high definition X-rays here. We have, if you look into the background, we have a C-arm too, which is a neurosurgeon that does come in twice a month, and we're able to use that at times. But most of the time, Dr. Berbessi and I will send right out for an MRI. Even the first time we see the patient, if we see a flare to us, something that just doesn't fit in a box of something we see with a soft tissue injury.
Okay. Are there any myths or misconceptions about the chiropractic care that you frequently encounter? If so, how do you address it or them?
So there's tons, a lot of people, if y'all don't know, Dr. Glassman and I, we're quacks, don't believe anything we say. We can't help with anything. But no, throughout history, everything that people believe is quackery. If there is some sort of substance to it, research is going to prove that. And like we answered a couple questions back, there's over 9,000 studies that show that chiropractic is beneficial to and aiding in rehabilitation of injuries to the human body. So what we do is we commonly dispel these myths. Everyone thinks that chiropractor can't refer out. We're portal of entry doctors. Therefore, we can, a patient can walk through our door and then we can refer to any specialist out there. That's one of the most common myths and misconceptions that we see coming in the door every single day.
I love that. And on the contrary, can you share any success stories or patient testimonials that highlight the effectiveness of chiropractic care in these cases?
Sure, Laura. I've got over probably 1,000 cases in 20 years that have seen physical therapy right away. And my assessment of that is therapy is wonderful for strengthening, wonderful for rehabilitation after a surgical procedure or some type of true soft tissue injury. But I always express this: if the road gets broken during a storm, unless you straighten the girders and get the road back to straight, you can't put the asphalt back down. So if the back is moving incorrectly after an injury, biomechanically, and physical therapy lays down muscle strength, and they do, and they stretch things, but if the joints are not working the way they should, then the muscle and tissue can't lay down upon them and move the way they will be able to move genetically.
Okay.
Okay.
Do you have a way of collaborating with other healthcare professionals, such as attorneys or insurance companies, to ensure comprehensive care for PI and workers' compensation patients?
Absolutely. So, it's a great question. Again, we use the same analogy of quarterbacking someone's case management, but effective communication between the lawyers, ourselves, and patients is imperative to having a successful relationship with our patients and seeing that patient through an entire care plan and back to somewhat normalcy, right, following this traumatic injury. So, we love to work with, like Dr. Glassman mentioned earlier, we've got neurosurgeons that come into the office. We'd like our medical doctors to be hands-on in our cases, right? So that cohesively we can work together rather than against one another for the sake of our patient.
Do you guys have a way of collaborating with other healthcare professionals, such as attorneys or insurance companies, to ensure comprehensive care for personal injury and workers' compensation patients?
Well, they tell you no, don't work.
Mhm.
Okay, because if we didn't have a clear path of coordination care, we wouldn't be the doctors that we are. We're great at diagnosing, we're great at biomechanics, we're not great at other things. What we are great at doing is figuring out what to use when. And that's why we have a medical doctor in-house, a neurosurgeon we refer to, an orthopedist, we have a podiatrist. It's knowing what joint, what doctor, when. And if we use great diagnostics like MRI, CT, and X-ray, we're able to open that window for that attorney or for that other doctor or physician to use the diagnostic we found and use it in a productive manner when that patient first walks in. We're trying to cut down the pain time, the time that a patient has an injury to the time they get relief. And if we can do that when they walk in, assess correctly, that next professional we send over, that doctor, that attorney will be very happy with us. That patient ultimately will get relief. And that's what we're looking for.
Absolutely. Do you use any specific techniques, or do you utilize any methods in your chiropractic treatments for your patients?
Absolutely. We use specific techniques here. We use a lot of passive therapies, which physical therapists will relate to: TENS units, ultrasound, different stimulation techniques. We use hydrobed therapy. We also use trigger point injections with our MDs. We also have something here that we separate ourselves in the industry. We have spinal decompression. It is not a $7,000-$10,000 machine. They start at $100. One of our machines goes up to $250,000. What it's able to do is decompress a specific disc at a specific level to give specific relief. And if we can do that first and foremost for our patients, we're delivering primary, premier care.
I love it. Besides personal injury and workers' compensation cases and patients suffering from car wrecks, striking injuries, slip and falls, as well as work-related injuries, do you treat any other types of patients and injuries or conditions?
Yes, ma'am. So we have tons of patients that come in. It is our job as chiropractors to get back here, get a thorough history from them, and then figure out exactly what diagnosis belongs to each patient, right? Furthermore, we're able to, like Dr. Glassman just mentioned, with the disc machines that we have, the decompression machines that we have in-house, we see tons of disc issues walk in the door that we're able to single-handedly help with. So yeah, we see a variety of patients walk in the door, and we pride ourselves on being able to help.
Okay. Can you discuss any ongoing research or studies that focus on chiropractic care for personal injury and workers' compensation cases specifically?
Yes, actually, there has been a lot of recent studies showing more so honing in on the timeline, right, of post-accident, getting into your chiropractor and or primary care physician within 48 to 72 hours following a traumatic injury is going to be, it is imperative to get in within those times to actually speed up the rehabilitation phase of each patient's care. So, there's been a lot of research done recently in the sense of time and what that does to each patient's rehabilitation and what that's going to look like.
And I know no care comes without any challenges. How do you address the unique challenges or complexities that may arise when treating your patients?
Challenges are more than complexities. Challenges are usually with the patient making time to come in, the patient being well enough after the initial impact to come in. So our main thing is, did you go right to a hospital? Did you go to urgent care? Did you get some type of medical care before you walk in the door? That will help us tremendously, because focusing on how the injury occurred and then what type of injury was sustained right away is the best means of overcoming and not having those hurdles come up later in the case.
Are there any specific legal or documentation requirements that you need to fulfill when providing chiropractic care for these patients that have a personal injury or workers' compensation claim and are working with an attorney?
Laura, it goes, I think. So if we don't document, diagnose correctly, and put our best foot forward every time we do a note to be as thorough as possible for each patient, we won't be able to document. That attorney, that insurance company, that judge should be able to read our notes and understand what we're doing, why we're doing it, and what the outcome we're trying to achieve. If we can communicate that, they don't challenge what you're doing, especially when the patient gives you quantitative outcomes after the fact with the improvements they've made under your care.
And Dr. Berbessi or Dr. Glassman, can you explain the importance of documenting and reporting progress and outcomes for these cases?
Oh, absolutely. It's imperative. Yeah, it's 100% the keynote for everything that we do is documentation. You know, having thorough communication and documenting every step of the way is going to not just help us, help the lawyers, but ultimately, you know, who we do this for is a patient. And that's who it's going to help. You know, it's going to allow them, you know, to have a clear delineation of care, right? What was done, what was the outcome, and ultimately, you know, get them compensated.
And how do you ensure effective communication and coordination of care with the patient's legal or insurance representatives?
We use a secret. We have an office so she can communicate with them, to tell a surgeon's notes what they're doing with an insurance company. It's very easy for her to communicate what our goals are. The attorneys know where we are in our case. They know where the patient's been referred to, and keeping that line of communication makes the attorneys even more happy to send us more patients, because with us, there's no clouds, there's no smog. They know what they're getting and they know when it's coming in.
Love it. Can you discuss any specific strategies or approaches you use to help personal injury and workers' compensation patients manage pain and regain functionality and to be able to get back to normal way of life?
Yes, absolutely. Our strategy here is to get them out for MRIs if needed, if warranted. Get that information back, and that way we can then take the case from that point forward and or co-manage with a neurosurgeon or orthopedic surgeon.
Okay. Are there any specific rehabilitation exercises or therapies that you commonly recommend to your patients?
That's what I was mentioning. Yeah, we do. You know, we do everything from like the passive therapies here. You know, heat, cold. You know, a lot of electric stimulation. But then, you know, if we need to get into some soft tissue work, I like to do some soft tissue work myself. I love to do some cupping. You know, coupled with chiropractic, you know, as well as, you know, we've got some laser therapy here. We've got some acoustic wave therapy. I mean, we have, you know, wide variety of tools, you know, in our tool bag here that we're able to pull from whenever is necessary. So again, it's a case by case basis, but, you know, I think until now we can honestly say that it's been pretty successful.
Wonderful. And you touched some of it, but maybe you can elaborate just a little bit more. Can chiropractic treatment be used along with physical therapy, acupuncture, dry needling, orthopedic, you know, treatment, or any other kind of treatment simultaneously?
100%. And we're all for it. We don't work against any of our other providers. We work with them.
Can you explain the role of chiropractic care in facilitating the recovery and return to work process for workers' compensation patients specifically?
That's each workers' comp, what the patient is trying to reachieve when they walk back to the workplace. It's not just walking in their home anymore, it's lifting 60 pounds repetitive through the course of the day. So that's where we really lean on our PT, our physical therapists in the community, where we'll get them functionally moving correctly. But the strengthening portion, we will refer out to a physical therapist. And if you're listening to this, we're the one chiropractic clinic you can lean on that will refer to you to help us with our care. Where most chiropractors will do it in-house, think they do it well. We know what we do well, and we do it really well. but we don't do our physical therapy, and that strengthening portion should be relied on with the practitioners that focus and are better at it than we are.
Mhm. And what advice would you give personal injury and workers' compensation patients who are considering chiropractic care for their treatment or as a part of their treatment?
So
What exactly inspired you to become chiropractors, both of you doctors?
so see firsthand how my father was able to, you know, input chiropractic in other people's lives and better people's lives, you know, as a result of it. And so, you know, I'm very blessed and fortunate to have seen that firsthand and to have believed in what I'm doing 100% wholeheartedly. You know, that's one thing that I can say that I share with Dr. Glassman is the passion for what we do. You know, we just want to see people get better in whatever capacity that is. And we're able to facilitate that with our own hands. And that's, you know, that's the magic right there.
And with me, I started a whole different direction. I started undergrad veterinary medicine, veterinary school, and realized that these hands are not made to put animals to sleep. So after crying through one or two nights at school,
Aw.
and after an emergency clinic night, I decided to go back to school. Sculpted a lot as a child, believe it or not. Sculpted figurines, sculpted busts of different figures from Greek mythology, and didn't know that my hands were not meant to sculpt, they were meant to heal. So this really fit my wheelhouse. My mental state was always ready for medicine. It was what to do. And the truth is, Laura, until about 8-9 months into school, where I questioned what chiropractic did neurologically, I sat down with a neurologist. He explained to me on a neurological model why it works, and when it's right to work for the body. Once I understood that, I went forward full-heartedly, and I'm blessed to have the hands God gave me to do what we do in this office.
That's just beautiful stories. Thank you so much again. Learned so much, and hopefully my viewers and listeners learned as much as I did today about the unique approach to the chiropractic care. Now, if anybody needs to find you, for treatment, if they're really in really bad pain, if they've been referred to you by a specialist, how can they find you? Do you have a website? What's the name again of your practice? Do you have any social media sources?
Well, I'm glad you asked. Our website is HMFCC.com. That stands for Hamilton Middle Family Complete Care. And our Instagram is also HMFCC. And here's the best part. If you have a TikTok, please go follow us. We are known as the Two Bald Docs.
Woohoo!
Two spelled like the digit.
I love it.
Bald Docs.
Thank you so much again. But before I let you go, I have a couple of pop-up questions. You ready for those?
Ready.
Okay. So, Dr. George Berbessi, who do you look up to the most in your life?
You know, it was mentioned earlier that my father's a chiropractor, and so you know, I think that for every young boy, you know, to look up to somebody and call them a hero, I think that all started with my father. But you know, I can honestly say that I only look up to two people in this world, and you know, one of them is my father's, my blood relative, which just kind of, you know, goes hand in hand. But you know, furthermore, you know, this guy sitting next to me is my hero. You know, Dr. Glassman. You know, you're not going to find many people in life that are just going to pour into you and help you out, put you in a position to win, right? Without wanting anything in return, and teach you what he has taught me on a daily basis, you know, about what we do in the care for our patients. The passion for what we do is what connects us. And I mean, I am so grateful for the opportunity to work with him, work under him, and have my father, you know, right beside me.
That's beautiful. And of course, Dr. Glassman, I have not forgotten about you. If you could turn time, if you, Dr. Glassman, could turn time back and talk to your 18-year-old self, what would you tell them?
God, you idiot. Don't buy motorcycles and listen to your mother.
Mm-hmm.
You're a mother, so you know that. If I could gone back in time, I would just say, listen to the people in your life that are a little older, that have a lot more world experience, because they're not just speaking to speak. They're speaking from experience, and they're speaking because they love you. And I grew up in a very loving house, but I will tell you, even friends and family that I have, I believe I have truly blessed myself with people around me that love me the way I love them, like I love the gentleman next to you. He is not just, he doesn't work underneath me. He works with me side by side. And it's great to pour into someone who is as great, and I think will be even greater than me at the end of his career.
That's just so wonderful. Again, thank you so much. That was Dr. George Berbessi and Dr. Russell Glassman with Hamilton Mill Complete Family Care. Ladies and gentlemen, I want to thank you all for listening to our episode today. For more tips and tricks on legal funding and personal injury law related topics, follow me, like, and subscribe to It's Time for More Injury Funding podcast on Spotify, Amazon Music, Apple Podcasts, and all other main podcast platforms worldwide. And also follow More Injury Funding on my website at www.moreinjuryfunding.com. I can't wait to see you and hear all my dear listeners very soon. Until then, be well.